Question 1. In the context of nuclear medicine, Dr. Simmons is preparing for a SPECT imaging session on a patient with suspected cardiac issues. The hospital has an ANGA camera that uses NiTL crystals for scintillation. However, Dr. Simmons notices that the images are blurry and less detailed. What could be the most likely cause of this problem? A. The ANGA camera's photomultiplier tubes are malfunctioning. B. The collimator is not appropriately matched to the imaging procedure. C. There is insufficient radiopharmaceutical activity in the patient system. D. The NiTL crystals are saturated and no longer functioning properly. Answer. Correct answer. B. The collimator is not appropriately matched to the imaging procedure. Explanation. Collimators are critical in SPECT imaging for ensuring that gamma rays from the radiopharmaceutical are accurately detected. If the collimator is not appropriately matched, the wrong hole size or type, the image resolution can degrade. Photomultiplier tube malfunctions or saturated crystals would result in signal loss but are less likely to blurriness. Specifically, low radiopharmaceutical activity typically causes lower image quality but not specifically blurriness. The proper collimator ensures clear image acquisition with high resolution. Question 2. Given the circumstances of preparing a TNT9 meters radiopharmaceutical Istolarsen, the radiopharmacist observes that the generator's weight appears cloudy. What is the most likely issue and how should he proceed? A. The generator may have an issue with Mo99 breakthrough leading to contamination. B. The radiopharmaceutical preparation was not mixed thoroughly. C. The eluate has reached in excess of Tc99 meters activity, resulting in precipitation. D. The solution was stored at an improper temperature, leading to degradation. Answer. Correct answer. A. The generator may have an issue with Mo99 breakthrough, leading to contamination. Explanation. Mo99 99 meters generators are designed to release Tc99 meters by elution. If the Mo99 breakthrough is excessive, it could cause contamination in the eluate, resulting in cloudiness or precipitate formation. This is a significant concern in radiopharmaceutical preparation as it affects purity. Patient safety. The other options are less likely to explain cloudiness in the eluate since precipitation would result from chemical reactions or decay, which are typically not caused by excess activity or improper mixing. Question 3. What factors contribute most significantly to the attenuation of gamma rays when using a gamma camera for imaging? A. The type of scintillation crystal used in the gamma camera. B. The energy level of the gamma rays emitted by the radionuclide. C. The photomultiplier tube's response efficiency. D. The thickness of the patient's body tissue in the imaging path. Answer. Correct answer. D. The thickness of the patient's body tissue in the imaging path. Explanation. The attenuation of gamma rays primarily depends on the thickness and density of the tissue through which the gamma rays pass. This results in some of the gamma rays being absorbed or scattered, leading to reduced signal intensity in the image. While the energy level of gamma rays affects the attenuation process, it is the tissue thickness that plays dominant role. The scintillation crystal photomultiplier tubes mainly impact the detection efficiency rather than attenuation. Question 4. What would happen if a radiopharmaceutical with poor radiochemical purity is administered to a patient in a SPECT scan? A. The radiopharmaceutical will likely not bind to the targeted organ, reducing image clarity. B. The radiopharmaceutical will have a higher effective dose to the patient. C. The image resolution will significantly improve due to higher purity. D. The radiopharmaceutical will decay faster, reducing patient exposure. Answer. Correct answer. A. The radiopharmaceutical will likely not bind to the targeted organ, reducing image clarity. Explanation. Radiochemical purity refers to the proportion of the radiopharmaceutical that is in the desired chemical form. Low radiochemical purity could lead to the radiopharmaceutical not binding to the target organ, which will significantly degrade image quality and diagnostic accuracy, while a poor radiochemical purity result in a higher effective dose or faster decay. These are secondary concerns compared to the primary issue of reduced image clarity. Question 5. When analyzing a gamma camera system for a quality control test, Dr. Allen observes a lack of uniformity in the flood field image. What is the most likely cause of this issue? A. The photomultiplier tubes are not calibrated properly. B. The collimator is too narrow for the procedure. C. The crystal is defective and not uniformly sensitive. D. The source used for the flood field calibration is of low activity. Answer. Correct answer. C. The crystal is defective and not uniformly sensitive. Explanation. A non-uniform flood field image typically indicates that the scintillation crystal is either damaged or has varying sensitivity across its surface. The photomultiplier tubes might cause issues with signal collection, but they are less likely to lead to the uniformity problem seen here. Collimator issues affect resolution but not uniformity directly. Activity of the source typically has less effect on uniformity unless it is too low. Question 6. In terms of radiation protection, which of the following practices is critical when handling radiopharmaceuticals in a nuclear medicine department? A. Ensuring adequate shielding is used to reduce radiation exposure to personnel. B. Increasing the room temperature to accelerate decay and reduce radiation levels. C. Limiting the amount of radiopharmaceutical used to minimize activity per patient. D. Using lead aprons for all patients to protect them from radiation exposure. Answer. Correct answer. A. Ensuring adequate shielding is used to reduce radiation exposure to personnel. Explanation. Shielding is the most critical factor in reducing radiation exposure to personnel when handling radiopharmaceuticals. This can include lead shields for containers and using proper protective barriers. Increasing temperature or limiting activity are not effective methods for radiation protection. Lead aprons are generally used for protection, not to reduce radiation exposure to personnel handling the radiopharmaceuticals. Question 7. Which of the following radionuclides is most commonly used in PET imaging due to its favorable physical decay properties? A. I-131B, F18C, Gu67D, Mo99. Answer. Correct answer. B. F18. Explanation. F18 is widely used in PET imaging due to its ideal half-life, about 110 minutes, which allows it to decay at a rate that balances between patient convenience and image quality. It also produces positrons with a favorable energy for detection by PET scanners. I-131, Gu67, and Mo99 have different properties that make them more suitable for other applications, such as SPECT, rather than PET imaging. Question 8. In an effort to minimize errors in radiation dose calculation for internal dosimetry, which model is commonly applied in nuclear medicine for calculating the absorbed dose from radionuclides? A. The MERD, Medical Internal Radiation Dose Formalism. B. The PERT Program Evaluation and Review Technique Model. C. The Monte Carlo Simulation Model. D. The Poisson Distribution Model. Answer. Correct answer. A. The MERD, Medical Internal Radiation Dose Formalism. Explanation. The MERD formalism is widely used in nuclear medicine for calculating internal radiation doses based on radionuclide characteristics, biokinetics, and the geometry of radiation absorption. This formalism provides a detailed patient-specific assessment of dose, which is crucial for accurate radiation therapy planning and safety. The other models are not used for internal dosimetry in nuclear medicine. Question 9. When evaluating the resolution limitations of a PET scan, what is a key consideration in understanding partial volume effects? A. The difference in tissue density across different organs. B. The maximum distance the radiopharmaceutical can travel from the organ of interest. C. The inability to distinguish small structures due to insufficient spatial resolution. D. The impact of higher energy photons on spatial resolution. Answer. Correct answer. C. The inability to distinguish small structures due to insufficient spatial resolution. Explanation. Partial volume effects refer to the inability of the imaging system to resolve small structures accurately due to limitations in spatial resolution. This results in the averaging of radiation signals from adjacent tissues, making small structures difficult to distinguish. Tissue density and photon energy are factors in image quality but directly explain partial volume effects. Question 10. In light of recent developments, how does the ALARA as low as reasonably achievable principle apply to the use of radiation in medical imaging? A. It ensures that imaging is only performed when absolutely necessary and at the lowest dose. B. It mandates that all patients be treated with the lowest possible dose of radiation regardless of the clinical need. C. It allows for higher radiation doses if the imaging procedure is critical for diagnosis. D. It requires all medical staff to wear full-body radiation protection at all times. Answer. Correct answer A. It ensures that imaging is only performed when absolutely necessary and at the lowest dose. Explanation. The ALARA principle is a key radiation protection guideline that ensures radiation exposure is kept as low as reasonably achievable, taking into account the clinical benefits of the procedure. This principle emphasizes minimizing radiation dose to both patients and personnel without compromising diagnostic efficacy. What? Optimization is critical. ALARA does not mandate unnecessary avoidance or full body protection for staff, as these are contextual and dependent on the procedure. Question 11. In light of recent developments in nuclear medicine, Mr. Dawson is working on a project to improve the efficiency of SPECT imaging. He wants to use attenuation correction to enhance image quality. Which of the following methods is commonly used to achieve this correction in SPECT imaging? A. Apply a ramp filter during image reconstruction. B. Use a cant to obtain attenuation coefficients and apply them in image reconstruction. C. Increase the photon energy in the gamma camera to reduce attenuation. D. Increase the scan duration to allow for better data collection. Answer. Correct answer. B. Use a cant to obtain attenuation coefficients and apply them in image reconstruction. Explanation. Attenuation correction in SPECT imaging is typically achieved by using CT scans to measure the attenuation coefficients of different tissues. These coefficients are then used to correct for the attenuation of photons during image reconstruction, improving the accuracy of the image. This process is crucial, especially in multimodal systems like SPECT. Options A, C, and D are incorrect because they do not directly address the issue of attenuation correction in SPECT imaging. Question 12. Given the circumstances of Mr. Gupta's work, he is using a radionuclide generator to prepare TC99 meters for a patient. Which of the following is the most important factor in ensuring the generator's efficacy? A. Ensuring the Mo99 meters generator is stored at -20 B. Verifying the radionuclidic purity of the TC99 meters obtained. C. Using dose calibrator to measure the chemical purity of the TC99 meters. D. Measuring the half-life of the Mo99 prior to use. Answer. Correct answer. B. Verifying the radionuclidic purity of the TC99 meters obtained. Explanation. The Mo99 meters generator must yield TC99 meters with high radionuclidic purity, meaning that the TC99 meters should be free from undesirable radionuclides, such as Mo99. This ensures that the radiopharmaceutical is safe for patient use and the imaging results are accurate. The other options either do not address radionuclidic purity directly or involve less critical aspects of the generator's operation. Question 13. What would happen if a gamma camera's collimator is not properly aligned during a scan? A. The image will have increased resolution. B. The image will suffer from distortion or blurring. C. The image will have improved signal-to-noise ratio. D. The gamma camera will not detect the radiopharmaceutical. Answer. Correct answer. B. The image will suffer from distortion or blurring. Explanation. Collimators in gamma cameras are critical for controlling the direction of gamma rays, ensuring that only photons from the desired direction contribute to the image. If the collimator is misaligned, the result is often distorted or blurred images, as the camera would capture photons from unintended angles. This can degrade the quality of the scan, making it less useful for decision-making. Question 14. Which of the following principles is most important when applying the ALARA as low as reasonably achievable principle in nuclear medicine? A. Use the highest possible dose to ensure clear images. B. Minimize exposure time and maximize distance from radioactive sources. C. Rely solely on shielding to protect personnel. D. Limit the use of radiation to only emergency situations. Answer. Correct answer. B. Minimize exposure time and maximize distance from radioactive sources. Explanation. The ALARA principle emphasizes minimizing radiation exposure to personnel and patients while still achieving the necessary diagnostic results. This is achieved by minimizing exposure time, maximizing the distance from radiation sources, and using appropriate shielding. Option A is incorrect because using the highest dose would contradict the ALARA principle. Option C focuses only on shielding, which is just one aspect of radiation protection. Option D is too restrictive as radiation use is essential in diagnostic imaging. Question 15. Based on the information provided in a recent study, Isto O'Connor, a radiopharmacist, is tasked with evaluating the sterility of a radiopharmaceutical. Which of the following methods is most commonly used for sterility testing in radiopharmaceuticals? A. Using a dose calibrated to measure chemical purity. B. Culturing the radiopharmaceutical in a growth medium to check for bacterial growth. C. Performing a gamma spectroscopy scan for radiochemical purity. D. Monitoring the patient's response to the radiopharmaceutical in real time. Answer. Correct answer. B. Culturing the radiopharmaceutical in a growth medium to check for bacterial growth. Explanation. Sterility testing of radiopharmaceuticals typically involves culturing the radiopharmaceutical in a growth medium to detect any bacterial growth, which would indicate contamination. This test ensures that the product is safe for patient administration. Option A addresses chemical purity, not sterility. Option C relates to radiochemical purity, not sterility. Option D is incorrect as monitoring the patient's response does not test sterility before administration. Question 16. Which factor has the most significant impact on the attenuation of gamma rays in tissue? A. The photon energy of the gamma rays. B. The chemical composition of the tissue. C. The physical decay rate of the radionuclide. D. The dose of radiation administered to the patient. Answer. Correct answer. B. The chemical composition of the tissue. Explanation. The attenuation of gamma rays in tissue is primarily influenced by the tissue's chemical composition, specifically its electron density. Different tissues, e.g., bone, muscle, fat, absorb and scatter gamma rays to varying degrees due to their differing atomic compositions, while photon energy does play a role. The chemical composition of the tissue is a more direct factor in attenuation. Question 17. Under the assumption that a medical physicist is preparing for a PET scan using a radiopharmaceutical labeled with F18, which of the following is most crucial for ensuring image quality? A. Ensuring the radiopharmaceutical is injected at a high dose. B. Ensuring the patient remains in a motionless position during the scan. C. Ensuring the PET scanner is calibrated to the correct energy window. D. Increasing the duration of the scan to capture more data. Answer. Correct answer. B. Ensuring the patient remains in a motionless position during the scan. Explanation. In PET imaging, patient motion can cause significant artifacts and reduce image quality. Keeping the patient still ensures that the data collected represents a clear and accurate image of the area of interest, while the other factors, such as calibration and scan duration, are important. Motion artifacts are a major source of image degradation. Question 18. Considering the evidence on radiation safety, which of the following would be the best method to protect medical staff from exposure to radiation during a diagnostic procedure involving a radioactive tracer? A. Increasing the use of lead shielding for all procedures. B. Using the inverse square law to maintain a safe distance from the source. C. Reducing the number of diagnostic procedures performed each day. D. Administering a higher dose to reduce scan time. Answer. Correct answer. B. Using the inverse square law to maintain a safe distance from the source. Explanation. The inverse square law states that radiation exposure decreases with the square of the distance from the radiation source. By maintaining a safe distance from the radioactive source, the exposure to medical staff can be significantly reduced. While lead shielding, option A, is important, distance is the most effective strategy. Options C and D do not address radiation protection effectively. Question 19. During the process of preparing a radiopharmaceutical, Dr. Nguyen discovers that the radiochemical purity of the TC99 meters has decreased below acceptable limits. What is the most appropriate course of action? A. Continue with the preparation, as the radionuclidic purity is within acceptable limits. B. Discard the preparation and prepare a fresh batch to meet radiochemical purity standards. C. Adjust the dose calibration to compensate for the purity discrepancy. D. Proceed with the injection as long as the sterility is intact. Answer. Correct answer. B. Discard the preparation and prepare a fresh batch to meet radiochemical purity standards. Explanation. Radiochemical purity is a critical factor in ensuring the safety and effectiveness of a radiopharmaceutical. If it falls below the required threshold, the preparation should be discarded and a fresh batch prepared to maintain patient safety and diagnostic accuracy. The other options would compromise patient safety and the imaging procedure. Question 20. In the context of radiation protection regulations, which of the following factors is most significant when determining the proper shielding for a radiology department? A. The energy of the radiation used in imaging procedures. B. The number of patients treated per day. C. The amount of time the radiation source is in use each day. D. The size of the radiation facility. Answer. Correct answer. A. The energy of the radiation used in imaging procedures. Explanation. The energy of the radiation is a crucial factor in determining the appropriate shielding for a radiology department. Higher energy radiation requires more substantial shielding to protect personnel and the public from exposure, while factors like patient volume option B, operational time option C, and facility size option D are relevant. Energy plays the most direct role in shielding design. Question 21. Which of the following is the most important factor to consider when preparing a radiopharmaceutical for intravenous injection into a patient? A. The sterility and chemical purity of the radiopharmaceutical. B. The type of radionuclide used in the radiopharmaceutical. C. The half-life of the radionuclide used in the radiopharmaceutical. D. The molecular weight of the radiopharmaceutical. Answer. Correct answer. A. The sterility and chemical purity of the radiopharmaceutical. Explanation. The sterility and chemical purity of a radiopharmaceutical are crucial to ensure patient safety and avoid any adverse reactions. Any contamination or impurity could compromise the effectiveness and safety of the procedure. Question 22. Which imaging technique is commonly used in conjunction with SPECT to correct for attenuation and improve image quality? A. X-ray computed tomography (CT). B. Magnetic resonance imaging (MRI). C. Ultrasound imaging. D. Fluoroscopy. Answer. Correct answer. A. X-ray computed tomography (CT). Explanation. In modern hybrid imaging systems such as SPECT, the CT scan provides information about tissue density, allowing for attenuation correction during SPECT imaging. This combination improves image quality and accuracy in diagnosis. Question 23. Dr. Williams is tasked with conducting a PET scan using F18 labeled glucose. Which of the following is the most important factor in ensuring that the scan provides accurate metabolic information? A. Ensuring the radiopharmaceutical is injected within 30 minutes of preparation. B. Ensuring that the patient remains well hydrated throughout the procedure. C. Administering the radiopharmaceutical in a higher dose for clearer imaging. D. Ensuring that the patient fasts for 6 hours before the scan. Answer. Correct answer. D. Ensuring that the patient fasts for 6 hours before the scan. Explanation. Fasting prior to a PET scan is important to ensure accurate metabolic imaging. When a patient is in a fasting state, their body will more readily take up the radiolabeled glucose F18, providing clearer and more accurate metabolic information. Question 24. What is the most effective way to reduce radiation exposure to patients during a diagnostic imaging procedure? A. Use the highest possible dose of radiation to ensure diagnostic clarity. B. Use the minimal radiation dose required to obtain adequate image quality. C. Increase the duration of the imaging procedure to minimize radiation intensity. D. Ensure that the patient is in a fixed position for the entire procedure. Answer. Correct answer. B. Use the minimal radiation dose required to obtain adequate image quality. Explanation. The principle of ALORA, as low as reasonably achievable, emphasizes minimizing radiation exposure while still obtaining the necessary diagnostic information. This is achieved by using the lowest radiation dose that still ensures good image quality. Question 25. Dr. Thompson is analyzing a nuclear medicine study involving bone scintigraphy. Which of the following radiopharmaceuticals is most commonly used for this type of imaging? A. Iodine-131, B. Technetium-99 meters MDP, C. Gallium-67, D. Fluorine-18. Answer. Correct answer. B. Technetium-99 meters NDP. Explanation. Technetium-99 meters NDP methylene diphosphonate is the most commonly used radiopharmaceutical in bone scintigraphy. It binds to bone tissue, especially areas of increased metabolic activity, which is useful in detecting fractures, infections, and tumors. Question 26. Which of the following principles must be followed when handling radioactive materials to ensure compliance with radiation protection regulations? A. Always use lead shielding to protect the hands during radiopharmaceutical preparation. B. Use the time, distance, and shielding principles to minimize radiation exposure. C. Only wear protective gloves when handling radioactive materials. D. Limit the use of radiopharmaceuticals to emergency cases only. Answer. Correct answer. B. Use the time, distance, and shielding principles to minimize radiation exposure. Explanation. The time, distance, and shielding principles are fundamental strategies in radiation protection. Minimizing exposure time, maximizing distance from the radiation source, and using appropriate shielding are critical for protecting personnel from unnecessary radiation exposure. Question 27. During a nuclear medicine procedure, which of the following factors primarily influences the image resolution? A. The amount of radiopharmaceutical administered. B. The energy of the emitted photons. C. The size of the radiation detector. D. The duration of the scan. Answer. Correct answer. C. The size of the radiation detector. Explanation. The size of the radiation detector plays a significant role in determining the resolution of the image. Smaller detectors allow for more precise localization of photon events, resulting in higher resolution images. While the other factors do play a role, the detector size is particularly important in nuclear imaging. Question 20. Which of the following is a common side effect of administering high doses of radiation in nuclear medicine procedures? A. Nausea and vomiting. B. Hair loss and fatigue. C. Acute radiation sickness. D. No significant side effects. Answer. Correct answer. A. Nausea and vomiting. Explanation. High doses of radiation, especially during certain diagnostic or therapeutic nuclear medicine procedures, can cause acute symptoms such as nausea and vomiting. These side effects are generally temporary and related to the body's response to radiation. Question 29. Which of the following radionuclides is most commonly used in positron emission tomography (PET) for oncology imaging? A. Iodine-131, B. Carbon-14, C. Fluorine-18, D. Technetium-99 meters. Answer. Correct answer. C. Fluorine-18. Explanation. Fluorine-18, which is commonly used in the form of F-FTG fluorodeoxyglucose, is widely used in PET imaging for oncology, as it is absorbed by metabolically active cells such as cancer cells. Its short half-life and suitability for metabolic imaging make it ideal for PET scans. Question 30. Which of the following methods is primarily used to ensure patient safety when administering radiopharmaceuticals? A. Conducting routine blood tests to monitor radiation exposure levels. B. Verifying the patient's medical history, including allergies and prior radiation exposure. C. Administering radiopharmaceuticals in the highest dose possible to ensure accurate imaging. D. Using lead aprons for all patients during diagnostic procedures. Answer. Correct answer. B. Verifying the patient's medical history, including allergies and prior radiation exposure. Explanation. Verifying the patient's medical history, including any prior radiation exposure or allergies to contrast agents, is critical in ensuring patient safety during nuclear medicine procedures. This helps identify potential risks or contraindications for certain radiopharmaceuticals.